One of the questions patients ask me most often is, how can I increase my semen volume? I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to explain everything you should know about semen. How does your body actually produce it? What occurs when you ejaculate, and what causes semen volume to decrease? Does it affect your partner? And finally, what methods can help boost semen volume? Let's dive in. Semen contains several different elements. Of course, most people know about sperm, which is produced in the testicles. So what percentage of semen do you think is actually sperm? Pause now, leave a comment below, and tell me your guess. The real answer is about 5%. That means only 5% of total semen volume is sperm. Many people believe that if their semen volume is lower than someone else's, it means their sperm may not function as well or that they may be less fertile. Well, that is completely false. The other parts of semen include fluid from the prostate, which creates prostatic secretions that help nourish sperm and help them move properly. And this makes up about 20 to 30% of semen volume. The biggest portion comes from the seminal vesicles, making up around 60 to 70%. These are two small sac-like glands located behind the prostate that store semen. And lastly, right before you. At the time of ejaculation, a very small portion of fluid is released from tiny glands located next to the urethra, also known as the urinary tube, called the bulbourethral glands. You might also wonder why some people experience a stronger, more forceful ejaculation, while others may notice more of a gentle release. The reason is that there are muscles surrounding the urethra, known as the bulbocavernosus muscle. During ejaculation, these muscles create rhythmic contractions that push the semen forward. In some individuals, these muscles are stronger, while in others, they may be weaker, and this difference affects how forcefully semen is released. Now that you understand what is considered normal and how your body functions, you might be thinking, could a weaker ejaculation force or lower semen volume harm my relationship? In 2018, a study involving 240 women asked detailed questions about how they felt about their partner's ejaculation and how it influenced their sexual satisfaction. The results showed that most women did not care about the amount of semen or the force of ejaculation. Only about 17% said their orgasm felt stronger if their partner's orgasm was also clearly strong. An even smaller group, about 13%, felt they might be less attractive if their partner did not have a strong ejaculation, leading to some self-esteem concerns related to semen volume. So overall, I would say if this is something you worry about, try not to. The large majority of people are satisfied, especially when both partners reach climax, and there is usually nothing to be concerned about. So why does semen volume decrease? If you look at men across different ages, you'll see that those who tend to have the strongest and highest volume ejaculation are usually in their 30s. After that, it gradually decreases with age, and several factors contribute to this change. These can include weakening muscles, diet, lifestyle habits such as smoking, and other medical conditions. Interestingly, even from one day to the next, semen volume can change because of different factors, including how well hydrated you are, how much stress you're experiencing, and which medications you may be taking. But what if you notice a sudden drop in semen volume that does not improve? What should you do, and what might cause it? One possible reason could be a blockage in the tube that carries semen to the urethra for ejaculation, called the ejaculatory duct. Or it could be related to low testosterone levels. Other possible causes include certain medications, with the most common one being tamsulosin, also known as Flomax, is commonly prescribed to patients who have an enlarged prostate and trouble fully emptying their bladder along with urinary symptoms. This medication can sometimes cause retrograde ejaculation. This means that instead of semen moving forward and out during ejaculation, it travels backward into the bladder and is later passed out during urination. While this is a known side effect of that medication, retrograde ejaculation can also happen because of diabetes, certain neurological conditions, or spinal cord injuries. So if you notice a sudden change, It's important to visit a urologist to make sure none of these causes are affecting you. Now let's talk about 4 ways you can increase your semen volume. I'll share the first 3, which may help somewhat, and then the 4th method, which has actually been shown to increase semen volume, so be sure to stay with me until the end. Number 1. Stop smoking. Smoking is a very harmful habit. Not only is it linked to lung cancer and lung disease, but it can also increase the risk of bladder cancer and is associated with erectile dysfunction. If you want to maintain strong erections, quitting smoking is very important. The theory is that smoking may cause nerve damage, which can reduce the production of fluids that help create semen volume. So this is just another good reason to stop that unhealthy habit. Number 2. Stay hydrated. Just like any fluid your body produces, proper hydration is necessary to help your body produce a healthy amount. Make sure you're drinking enough fluids throughout the day. A simple way to check is by looking at your urine. If it is a light yellow color, similar to lemonade, you are likely well hydrated. Number 3. Do Kegel exercises. I've talked about Kegel exercises before in another video, and I've mentioned that they are not right for everyone. However, if you don't have urinary symptoms, pelvic pain, or erectile dysfunction, especially at a younger age, these exercises can be very helpful. They work by strengthening the pelvic floor muscles, including the bulbocavernosus muscle, which helps increase the force of ejaculation. This means you may empty semen more completely. So while you may not be producing more semen, you may be releasing more of what is already there, so less is left behind. Before I move on to number 4, I do want to mention that there are currently no FDA-approved supplements proven to increase semen volume. Many supplements claim they can boost semen volume and promise guaranteed results, but at this time, there is no strong scientific evidence showing that there is one specific supplement that will reliably do this for you. Number 4. The most reliable way to increase semen volume is to ejaculate less often. The reason is simple. If more time passes between ejaculations, your body has more time to build up fluid. Researchers actually studied this. They followed 27 men and collected semen samples from them each month over a period of 16 months. The participants were asked how long they had waited or remained abstinent before ejaculation. After analyzing all the data and looking at changes in semen volume, researchers found that for every additional day a person waited to ejaculate, semen volume increased by about 10%. When looking at men who waited 4 days or less, the increase was about 12% per day. After 4 days, the increase slowed down to around 7 to 8%. So yes, if you wait a couple of days, you will likely notice more semen volume during ejaculation. All right, that's everything for today. Thank you so much for watching, and as always, remember to take good care of yourself, because you truly deserve it.